My guest today is Ben Brown, a naturopath, nutritionist, science writer, and speaker. He is the author of The Digestion Health Solution and editor of the Journal of Orthomolecular Medicine, contributing editor of Integrative Healthcare and Applied Nutrition, and the director of clinical education for Pure Encapsulations. He's also on the advisory board of the BCNH College of Nutrition and Health, where he is also a lecturer. Ben, welcome to the show.
Thanks for having me. It's great to be here.
Terrific. Well, we're going to talk all things digestion here today, and specifically around IBS, irritable bowel syndrome, or in your recent talk, which I had the pleasure of attending at the International Congress of Naturopathic Medicine in London a few weeks back, you sort of redefined it as irritable bowel symptoms, not syndrome. So before we maybe dive into that, perhaps you can kick things off here with giving listeners just a traditional definition of IBS and perhaps a little overview of, how many people this might affect.
Yeah, absolutely. So the traditional definition is really defined by a set sort of symptom criteria. So you have IBS, basically, if you regularly have cramping, pain, bloating, alterations in bowel habits, and symptoms of that nature, really. And, without getting too technical, that's about the sum of it. And if you have those chronically and pretty regularly, you fall into that sort of loose definition. Within that definition, the severity of symptoms can vary quite a lot. So for some people, the symptoms could be quite mild, whereas other people, they can be really debilitating, impacting ability to work and hold down, day-to-day, function, really. It's can be quite significant. In terms of incidence, given the very generalized ability of those symptoms and the varying severity of them, very broadly, it's estimated that around 1 in 4 people suffer from IBS. So the prevalence is extremely high, and this makes it the most common gastrointestinal disorder out there, basically. So it's incredibly common.
Absolutely. It's definitely something that I see often in clinical practice, whether it's general population, athletes as well. And of course, if we jump right in here, does IBS exist? Should we be reclassifying this as irritable bowel symptoms? Can you explain a little bit more about that?
Yeah, so that's sort of my perspective. I've been working on this topic and in this area for some time, written a book on it and, publishing some research around it. And basically, I think, a lot of the conundrums we have with IBS, problems with diagnosis and treatment can be solved by adopting the view that, well, actually it doesn't exist. And it sounds a bit crazy and a bit of an alternative view, but what I mean by that, and it makes a lot of sense, it's quite logical, and that is that actually IBS has multiple underlying causes, and the condition IBS itself is not the end goal in terms of diagnosis and treatment. So there's most likely something else underlying the development of those symptoms that we can identify and help people manage. And that's what I mean by, it doesn't exist. It's, we need to be digging a bit deeper and moving away from the sort of diagnosis of IBS per se, because it doesn't really help anyone much.
No, it's often the case where, clients come in or an athlete comes in and tells you their symptoms of what they have. And of course, the doctor or practitioner will say, well, you have IBS. And it's almost like it's exactly what the patient told the practitioner in coming in. So we haven't really solved much of anything, have we? So, in your talk, you list some underlying causes of IBS and, of course, grouping them in under 3 categories. So, functional imbalances, I believe you had, lifestyle, environment, and nutritional factors. So maybe we can start with the functional imbalances, and perhaps you can walk listeners through a few of those root causes.
Yeah, absolutely. So really what we're talking about with sort of functional imbalances are things that are going on within the physiology of a person. It'll vary from person to person, and often there's not just one thing. There can be multiple things interacting, but they're things that we know are features of some people with IBS symptoms. And we also know that addressing these, so actually, using interventions that help improve these imbalances, so to speak, can bring about good symptomatic improvements. So that's sort of what we're talking about to set the scene. And within that area, there's quite a few things that fall loosely into that sort of category or of factors that could be antagonizing or giving rise to the symptoms of IBS. And, we can pick away at a few of them. I think I listed about 7 or 8, but, one of the core ones that I think is particularly interesting that's emerging in the literature recently is this concept of low-grade inflammation in the gut mucosa. And, the interesting thing about this idea is that traditionally inflammation was thought to be quite distinct from IBS. If you have IBS, it's not an inflammatory disease, but what we're beginning to understand is that actually it is a mild type of inflammatory disease for some people at least, and you can detect this, and it appears that using anti-inflammatory type interventions you could improve symptoms as well. In fact, some researchers are tending to suggest now that IBS sits on a continuum as a predisposing factor to inflammatory bowel disease in some cases, which is remarkable and something we weren't talking about or thinking about previously. So that appears to be a big one.
Yeah, I mean, it's amazing how obviously today with over 2/3 of the population being overweight, pre-diabetes, diabetes on the rise, this idea of chronic, persistent, low-grade inflammation is so pervasive in the community that it's no wonder that we have so many people potentially experiencing a lot of the symptoms of IBS. Can you walk us through a few more in terms of things like constipation, dysbiosis? Those are often common ones that are brought up.
Yeah, absolutely. Yeah, I mean, they're two great ones. I mean, constipation also has not traditionally been thought to be a cause of IBS. As far as the textbook goes and clinical symptoms, generally what happens is people differentiate chronic constipation as being quite distinct from irritable bowel syndrome. But there's a group here in the UK where I'm based that have been looking at this for a number of years. They're based at a hospital sort of arm of Oxford University doing some research into gastroenterology up there. And they actually coined this syndrome that gives rise to IBS they call overload overflow syndrome. And what they were able to identify is that a subset of people, their estimates are quite high, about 1/3 of people who present with IBS symptoms have essentially chronic constipation masquerading as IBS. And when I say masquerading, what's happening is there's a chronic sort of build up and slow gastric transit, which is very characteristic of constipation. But what's happening is on top of that, if there's any stress or, it could be emotional or it could be eating some problem foods, what can happen is it'll sort of cause that buildup to overflow and cause diarrhea and pain and discomfort, which looks, like this classical definition of IBS, which isn't traditionally considered to be constipation. So what them and a few other groups independent of them have demonstrated quite clearly is that when you identify this subset who actually just have chronic functional constipation and then treat the constipation, the IBS goes. So that's a really interesting thing to consider and often overlooked in patients who present with IBS.
Definitely. I mean, I think some of those ones that we see as well in clinical practice around constipation, things like, dehydration, things like lack of fiber in the diet, things like dysbiosis, which, maybe you can dovetail into here.
Yeah, absolutely. Yeah, so dysbiosis is probably the big one because what we're really talking about here is one of the sort of fundamental mechanisms for which gastrointestinal symptoms develop. It's really, to define dysbiosis very simplistically, what it is an overgrowth of bad bacteria and a poor representation of good bacteria. I'm not sure if there's such a thing, but that's broadly what we're talking about here is some sort of problem in the gut ecosystem. And and this is one of the sort of most replicable findings in people with symptoms of IBS is this alterations in bowel flora. And there are two sort of mechanisms by which we think this is contributing to symptoms. The first is that they're over fermenting food. So particular bacteria, particularly good at fermenting carbohydrates in particular, that cause a lot of gas and distension and discomfort. That interacts with muscles and nerves and gives rise to all the other symptoms like pain and cramping and alterations in bowel habits and things. The second thing that's going on is that the bacteria themselves, beyond the gas, are producing, let's say, toxic metabolites, to overgeneralize it. And those toxic metabolites interact with the gut itself, and then even the systemic immune system and nervous system, and can give rise to symptoms of IBS as well. So this is really a big area of interest, both for clinicians and researchers. And part of the reason the interest is there is because we can do something about it. There's a lot of known interventions that we can use to improve this issue of dysbiosis, and a number of them have been shown to bring about really good improvements in clinical symptoms. I'm talking about things like probiotics, prebiotics, and dietary interventions that are designed to, change the gut flora or microflora.
Yeah, it's incredible how, again, processed food intake, fast food intake can really just totally deplete that ecosystem, leading to just that dysbiotic bacteria and just plummeting the diversity of the gut. And of course, all those acellular carbs, as you mentioned, then all of a sudden you've got the bacteria feeding off of this and creating this environment that's so perfect for discomfort and adverse symptoms. Another condition that's become obviously quite popular, so to speak, in the last few years is SIBO. I have more and more patients coming in saying, hey, I think I've got the SIBO. Can you talk about the connection there with SIBO and IBS and how that fits into the picture?
Yeah, absolutely. And I mean, the way you've painted it just there is beautiful. I mean, the way more and more I'm thinking about the gut is, and the gut microflora is, it's just an ecosystem like any other ecosystem on the planet. And what's happening is because of modern processed diets, we're not feeding the forest very well, basically.
Absolutely. Clear cutting is probably a better.
Yeah, clear cutting is true, and we even think that there's species extinction now as well, which is a real problem. So, but getting back to SIBO, essentially what's happening there is a unique type of dysbiosis where you have an overgrowth of colonic bacteria. So normally in the gut, most of the bacteria sit in the colon, as you know, and there's a lower preponderance of them in the small intestine, which sits above it. If it was a sort of logical progression there, and what's happened is in SIBO, you've got this overgrowth of the colonic bacteria up into the lower section of the small intestine. And essentially right there is a scenario where you've got good bacteria where they shouldn't really be, and they're fermenting food sooner than they should be. And that sort of interacts with the local environment, the small intestine, in a way that, again, gives rise to symptoms through gas and toxins and bloating and pain and changes in muscle and immune function. So that's sort of the background of what SIBO is, and a tremendous amount of interest in this area as well, because again, we know by identifying SIBO and then treating it, essentially the best documented method is certain antibiotics. It can bring about symptom improvement, but there are problems with this sort of view of treatment of SIBO, is that it often reoccurs. Often the treatments are not particularly effective. So I think where I'm going, and a lot of other clinicians are going, and researchers even with SIBO, is that, well, rather than just looking at it like we've got bugs in the wrong spot, let's kill off the bad bugs. It's like, well, why are they there in the first place? And I think that's a more important question. And it seems that there are a number of different factors that predispose people to SIBO that perhaps we should be addressing, rather than just looking at it like, let's kill the bad guys and hope that eradicates the problem, because it often doesn't, and it'll come back.
Yeah, very well said. It's definitely something that I see, that sort of cyclical nature of, you identify it in a test, you provide a protocol, you do some eradication, the client feels better, but lo and behold, a few months down the road or longer, then all of a sudden these symptoms start coming back because, whether it's the diet, the environments, we'll talk about stressors in a minute here, but all those things tend to be playing this role into recreating this environment. And If we stay on this subject here and just maybe finish off with another one that's obviously very popular, this idea of leaky gut, intestinal permeability, definitely one that with athletes, especially endurance athletes, is something that is highly prevalent, especially the longer duration ultra marathoners, etc. So, what's the connection there between the leaky gut and potentially this IBS?
Yeah, it is a big one, and essentially what's like, as I'm sure you well know with your work in athletes, is that with intestinal permeability, essentially what you've got is a stressed gut, for different reasons, and there are many, but the gut is physiologically stressed. The cellular permeability is increased as a result of that stress, basically, and you get increased translocation of what we call endotoxin or lipopolysaccharide from the gastrointestinal tract through into the gut mucosa, even into systemic circulation. The problem is a little bit of intestinal permeability is physiological. It's quite normal. The gut needs to be permeable, and a bit of toxin comes through. That's perfectly fine. But when you've got this increased stress and a higher level of this passage of toxins from the gut into the mucosa and circulation, you can then start to activate mostly the immune system, which then can interact with nerves and muscles and give rise to the symptoms of IBS. So it's been known for a number of years that intestinal permeability is present in a subset of people with irritable bowel-like symptoms, and more recently there's been some work looking at potential interventions for that. Most notably, there was a fabulous, and it's pretty preliminary stuff, but there was a really fabulous series of investigations done recently where a group were looking firstly in more diarrhea predominant IBS, which is more strongly associated with intestinal permeability. What they were able to identify is that there's a defect in the synthesis of an amino acid called glutamine in the gut mucosa, which is responsible for keeping the gut less permeable. They then went, well, if that's the case, let's try glutamine in a bunch of patients. They then conducted a clinical trial and found that it was quite effective for reducing symptoms, reducing markers of permeability, and it appeared to be quite a good intervention. It's just one study. It's the first that I'm aware of in patients with, defined IBS, but it's pretty exciting to see that sort of work being done now at least in the scientific literature.
Yeah, it's impressive how glutamine supplementation really can impact the gut, particularly. I know there's a lot of oftentimes we see studies around immunity, and of course, in people who are really immunocompromised, it can be beneficial. But definitely for folks with gut issues, and particularly intestinal permeability, we see a lot of benefits. So it's exciting to see some of that research coming out. And as you said, it's normal for all of us have a little bit of permeability going on. There's this general noise that's happening, which is fine. The immune system allows, but then when that noise or signal gets too loud, then all of a sudden we get this heightened response, and that's when the problem starts. So great run through there of some of the functional imbalances that can come in, and we can obviously see there's a lot of underlying causes here. But if we shift gears over to the nutritional factors, what could lead to IBS on the nutrition specific side of things?
Yeah, that's a great question, and there's a few things that are really emerging to be particularly important. Let's start with one of them that's a big topic, and that's intolerance to sugars and carbohydrates. And it's a big topic because there's been quite a lot of investigation in this area just in the last 5 to 10 years in particular, and although it's been known about for close to 100 from what I can gather in the scientific literature. So different groups have looked at it over many years, and the basic premise has remained the same over that time, and that is that carbohydrates can be fermented into gas, and they can also
sometimes very well.
Yeah, exactly. By some people, really well, yeah. And they can also have an osmotic effect. And some carbohydrates are not absorbed very quickly, so they sit in the gut like fructose. And because of that, by osmotic, it sort of attracts water. So if you've got a sugar sitting in the gut and it's pulling water into the gut, you know what's going to happen. It'll start to cause discomfort and alterations in bowel movements and diarrhea in particular. So these sort of intolerances to different sugars has emerged as particularly important. And one of the diets that's come to the forefront in this area is the so-called FODMAP diet, which is designed to essentially identify the carbohydrates that people are not tolerating and then remove them. So you sort of systematically go through, is it lactose? Is it fructose? Is it certain fibers? And remove those from the patient's diet. So that's a big one. But I think, beyond that sort of specificity of particular sugars, I think there's a bigger issue, and that is that people are just eating too much carbs, especially refined carbs, and too many processed sugars. And I mean, that's a good place to start if you've got digestive problems.
100%. Yeah. I mean, sometimes these simple heuristics, like even a low carb strategy or whatnot, what you end up finding is, people then eat far fewer processed foods and sugars. And of course, we see an improvement in gut function. And of course, they could achieve that using different nutritional strategies, but it just so happens that some of the ones that definitely limit a lot of the processed foods, we're going to see some definite improvements. And, how about food sensitivities? Is this part of the picture as well?
Yeah, absolutely. So, it remains unfortunately a little bit controversial, but the idea that certain foods could be aggravating IBS, I think, has certainly got weight to, take notice of. And there are several investigations that have been done in this area, and we know for sure that, if you can identify what we call sort of more delayed reaction sensitivity, so not like an allergy, but a more subtle type of food sensitivity through things like immunoglobulin testing or IgG testing, and then, construct a personalized elimination diet based on that, people get better. So, the controversy exists more around the I guess you could say the mechanisms by which this is all occurring, but the proof's in the pudding. Sure. And clinically, people just get better, so you can't really debate that. And the tricky thing is that it varies, widely from person to person. So it is highly personalized, but there are some common offenders. It's wheat, dairy, proteins like casein, and nuts and soy and things, which are common allergens as well by chance. So there are some key things to look out for there.
For sure. And you mentioned obviously the FODMAPs previously, and of course, things like bread. Obviously, gluten was one of the ones where we used to flag that as a potential offender. And of course, now folks even in the conventional areas are highlighting the fact that it could be more the FODMAPs in the bread. But as you mentioned, regardless, most of our clients and patients are just looking for relief. So removing some of these foods, sometimes even just for the short term or moderate term, can definitely provide a lot of relief. And if we round out some of these nutritional factors, vitamin D deficiency, how does that play a role?
Yeah, I mean, that has really, been shown to be particularly important for people with IBS-like symptoms. And, vitamin D deficiency is incredibly common in the general population, but it's much higher in people with these kinds of symptoms, almost double. So the thing there is that vitamin D has a number of really important roles in maintaining gastrointestinal health, including keeping that inflammation in check, keeping that permeability in check, keeping that dysbiosis in check that we just spoke about. So it's kind of hitting lots of different areas. And if you're suboptimal and you're not getting enough, which, most people aren't anyway, these things get a bit out of control, and that could give rise to IBS-like symptoms over time. And quite clearly, I think we can see now that if you've got, vitamin D deficiency and you correct that, so you bring your blood levels back up, the symptoms can be mitigated. So it's a really important consideration for anyone who's exhibiting these kinds of symptoms.
Yeah, definitely part of the picture. And of course, today with a bit of the sun-shy lifestyle, that people are fearing a little bit of the sun. And of course, for good reason in hot parts of the day, obviously wearing, being mindful and protective and using sunscreen, etc. But I mean, for a lot of the time, just not getting enough exposure to, that 20 to 30 minutes a day on limbs is definitely really important to get those levels back up. And most people, unfortunately, being stuck inside at work, or even athletes who are outside in the sun, Kenyan runners are even deficient in this, wearing sort of the longer sleeve outfits and being, fearful of some of the being out in the hot parts of the day. So definitely one to look out for. Now we've touched on the functional imbalances and nutritional factors. What about areas like stress, circadian rhythms, physical activity? How do these things fit into IBS?
Yeah, I mean, they're a really important part of the picture, and I think it's often overlooked that these simple lifestyle changes can have big effects on our health, and this is particularly true for digestive health. I mean, really, at the top of this list is stress and circadian disruption. We can touch on physical inactivity next, but they're particularly important, stress in particular, because it often coexists with the disorder. The gastrointestinal problems cause stress, and the stress causes the gastrointestinal problems. So whether or not it was the cause, most people have a problem in this area by the time their symptoms are fully blown or developed. And it's not to say that the symptoms of IBS are all in people's heads. That's a really old, outdated, ridiculous idea. What we're talking about here is the coexistence of nervous system and brain dysfunction with a gastrointestinal disorder, because the two are interacting and interrelated. So the way I often talk about it is, when you want to get these symptoms under control, you've got a bottom-up approach, excuse the pun, where you're focusing on, getting the gut right. But you've also got a top-down approach, which is where you're using your brain and your nervous system to help control the nerves in the gut. So things like, relaxation and meditation and stress reduction techniques can be really powerful for a lot of people with these kinds of symptoms, because you're sort of harnessing the ability of your own nervous system to calm down the nerves in your gut. So I think that's a big one is stress.
Definitely. I think that almost that type A personality as well can be on that mental emotional side. I've seen a lot of endurance athletes where digestive issues are part of the concerns, chronic concerns, and a lot of things help to improve those when you apply, whether it's changes in nutrition, supplements, etc. But oftentimes these folks, that just inherent mental emotional stress is really driving a lot of the system. And last week I actually had Miguel Mateus on, who dug deep into that sort of brain, guts, microbiota sort of axis. So for folks who want to dig in a little bit more to that, you can definitely check out last week's episode.
Right.
But for yourself and your clients and people that you see, Ben, how does stress really play a role in a lot of this?
Yeah, I mean, it's, like I said, it's really fundamental. So it's as part of management of IBS, I really think incorporating things like basic cognitive behavioral therapy, diarising mood, as well as bringing in things like breathing exercises and meditation techniques, yoga, etc., can be really powerful. I mean, what works for one won't work for another, but personalising that in a way that sort of applicable and suits the individual is really key and can be a great complement to therapy. The other thing is is this issue of circadian disruption, which is really just a fancy word for your sleep's a mess, and it's a little bit more than that, because circadian disruption is not just a sleep problem; it's also a lack of synchronicity between light and dark cycles. So you can have circadian disruption and be sleeping just fine. What we're really talking about here is overexposure to light at night. And fundamentally what's happening here is normally our body follows the circadian rhythm. On exposure to darkness, our brain starts producing melatonin, and so does our gut, in fact. And melatonin plays a really important role in regulating gut health, nerve function, reducing inflammation, muscular contractions, all sorts of stuff. And if you're not making that melatonin at night due to overexposure to electronic light is the main cause, you can really develop bad gastrointestinal symptoms. In fact, it's the other thing is like sleep restriction. So people who are shift workers, just not sleeping well, will develop a high incidence of these kinds of symptoms. In fact, sleep restriction studies have shown if you just have one night of sleep restriction, in these studies, about 50% of people will have symptoms that look like IBS the next day. So doesn't take much, to flip the switch and start aggravating these kinds of symptoms. So that's a really big one that's often overlooked. And, how do you deal with it? Well, it's lifestyle changes. So reducing light at night exposure and, getting good sleep.
Yeah, it's incredible how everything sort of ties in. You mentioned, lack of sleep, and all of a sudden the next morning, cravings for more processed foods, sugary foods. We have a exaggerated blood sugar response, and all these things sort of tie in to create that perfect environment for some of the stuff to take root. And of course, if we talk on the testing side of things, are there any conventional tests being used that are going to be helpful for helping to diagnose irritable bowel symptoms? Do we need to even diagnose it if we're really just talking about the symptoms and trying to dig deeper? And how about some of those functional tests, like the CSA tests, food sensitivity tests? Do they help to inform the practitioner?
Yeah, absolutely. I mean, a number of these are quite valid, particularly when you're looking. I mean, the key areas they're particularly useful is when you're looking for food sensitivity, so carbohydrate intolerance and immune-mediated food sensitivities, gluten sensitivity, identifying vitamin D deficiency can be useful with blood or just, I think it's pretty safe to assume that a lot of people are deficient as well, depending on their history and exposure. And then a lot of these tests really come into play for these functional imbalances, so it can be quite difficult otherwise to identify something like exocrine pancreatic enzyme insufficiency, like you'd just be guessing. So
for sure.
Yeah. So using some of the tests that identify, things like fecal elastase 1 and, low-grade inflammation you can pick up with fecal calprotectin, intestinal permeability. There's a few different biomarkers for that now, bile acid malabsorption. So there's quite a few things that can be quite useful for helping to at least rule out or even identify some of the underlying things that are going on for people. I think are quite valid, time-saving, and can really help personalize treatment.
And of course, from a client's perspective or even a practitioner, when they're, when someone comes in and they're treating someone with irritable bowel like symptoms, if we look at this from sort of 30,000 feet, I know it's always difficult to give exact strategies here, but in terms of potential solutions or overarching principles, are there certain themes that you've seen over the years with working with clients?
Yeah, absolutely. I think the curious thing is, I wrote a book on this topic and dove deep into, some pretty, the specific areas and a lot of detail. And the funny thing is, I think often it's the simplest things that bring about the best results. And, I wish I had put in the book a chapter on like chewing and and just like, eating mindfully and, cooking food at home and stuff, because these things are huge and they're just completely overlooked and can have a massive impact. So I think, eating meals with other people, chewing food thoroughly before you swallow it, eating good quality home-cooked food, processing food in a way that makes it more digestible, so cooking it, soaking it, stewing it, cooking in these traditional methods and ways, all of these things will improve the digestibility of food. It's immune tolerance and can often mitigate some of the symptoms before you get into the, more detailed, personalized underlying problems that could be going on. So I think, I really think a take home for me over the years is just keep it simple.
Very well said. And of course, definitely, mealtime scrolling through Instagram or Twitter or Facebook is definitely something a lot of young athletes and young clients are doing. So, as you mentioned, keep it simple. Just put the phones down, turn the TV off, enjoy your meal, talk to friends, colleagues, family, etc. Definitely a great place to start. I think another one is clients often assume that raw food is always going to be easier to digest. And obviously, a lot of times can be the opposite. So great to point out that cooking foods and using some of these traditional methods is going to be helpful for folks. Now, what about on the supplementation side of things? If we talk probiotics, are there certain strains or anything in particular that folks would look out for, practitioners?
Yeah, I mean that's a big one I get asked about a lot is probiotics, and really it's there's a lot of different messages, and most of it sort of comes from people selling the products. But the take home for people is you just identify a good product. And by that, I mean, ideally one that's been shown to work for the problem you're using it for. So if you're using it for IBS, great if it's got a clinical study to show that it actually works for that condition on those strains. So we differentiate probiotics based on strains, and the strains have, can have very different effects. So it's important to have a strain that's been shown to work for what you're using it for. Beyond that, the dose doesn't really matter. I know there's a huge sort of focus on more is better, but
for sure, get that 100 billion capsules.
Yeah. But it doesn't matter. Really, the best guide for the dose is the dose that was used in the clinical study that you're looking at. But it's difficult to navigate, unfortunately, unless you're familiar with the science. I think there's a reference in my book if you want to get into it. But the dose can be effective from millions to billions to trillions. So forget about doses. I think it doesn't really matter that much. And the other thing is if you're trialing a probiotic for IBS, what works for you is not going to work for another person, even if it's the best strain in the world, it's got a clinical study on it, and it's the right dose. So, just be patient. You really want to try a product for at least 4 weeks. If it doesn't work, try a different one, because there's half a dozen or more now that have been well studied that, are quite good for relieving these kinds of symptoms. So, be patient, try it. What works for you is not going to work for someone else, and do it that way. But they can be extremely helpful, and for some people. So definitely worthwhile trying.
Terrific, Ben. Well, listen, great insights here. Really appreciate you taking the time here. So before we wrap up, one last question for you. Where do you think the evolution of the research on irritable bowel-like symptoms is headed? Where will we be in the next 5 or 10 years?
Yeah, I really think it's all about personalization. I think what we're starting to see is a real movement away from, let's sort of blanket, these symptoms as a condition called IBS and move towards, what's actually causing it? What's the underlying problem from person to person, and how do we develop methods of identifying what's going on for that person and appropriating individualized treatment. And certainly that seems to be where things are going.
Fantastic, Ben. Well, listen, appreciate you coming on the show today. Where can people stay connected with you, pick up the book, and keep up with your fantastic work?
Yeah, so I've got a website that sort of plugs into the book, social media, etc. And the URL is scientificwellness.com. So if you jump on that, you'll click through to my publications, events, and other media.
Terrific. Well, I'll definitely include the link there and some of the papers we discussed